Hi, my name is Dr. Rute and I'm a general practitioner. I decided to do this video as an additional source of information around Strep A infection. There's been a lot in the news about Strep A infection, and that's because there's been an increase in the amount of children who are being diagnosed with Strep A infection and an increase in the amount of children who have died as a result of Strep A infection when we compare this to the previous few years. Understandably, this is really worrying to parents, worrying to children, to schools, to teachers, to families, and even us as doctors are on high alert. Now, with that being said, it's really important to remember that we are in a high season where children are getting a lot of colds and flus that are due to viral infections. And so the majority of the time that a child will present with a cough, a sore throat, or a fever, there's a higher chance that that's likely to be due to a viral infection that doesn't need antibiotics. However, we need to continue to be on high alert so that we're able to distinguish which children are likely to have a bacterial infection or which children have a bacterial infection and therefore need antibiotics. This video is going to look at what is Strep A infection, what is scarlet fever, what is invasive group A streptococcal infection. We're also going to look at what are the symptoms, how do you get it and how do you pass it on, how is it diagnosed, how do you treat, how can you help reduce the risk of transmission, or what are the preventative measures that one can take, and what are the rules around school isolation. And in the last part of the video, we're going to look at when to call the GP or 111 and when to call 999. Let's start with the definitions. So what is Strep A? So Strep A is short for streptococcal infection. And Strep A or streptococcal infection is a bacterial infection. It is common amongst children from 2 to 8 years old. It is very contagious, so it's easy to pass on, and it's usually passed on through direct contact, through coughing, through sneezing. Although it's highly contagious, the majority of the time these symptoms are mild. Now we've defined Strep A as a bacterial infection. Now if you put Strep A at the top and underneath, this bacteria causes different types of diseases or different types of infections. It tends to cause things like strep throat, so tonsillitis or pharyngitis, or things like skin infections, and another one is scarlet fever. Now that's the one that's been talked a lot about in the news because there's been an increase in the amount of children who are being diagnosed with scarlet fever. So scarlet fever is a bacterial infection caused by Strep A. A child would usually present with initially flu-like symptoms. So they'll feel unwell, they'll have a high temperature, they might complain of a headache, nausea, vomiting, sore throat. They might also have swollen glands or swelling around the neck. After about 12 to 24 hours, they might also now develop a rash. Now this rash usually starts off on the trunk, so on the chest and back, and it's a pinprick rash. It looks red on lighter skin. The rash also has a sandpaper kind of feeling or texture, so when you feel it, it feels quite rough like sandpaper. Other signs of scarlet fever include flushed red cheeks, easier to see on lighter skinned children, and also a strawberry tongue. So a strawberry tongue, this is where the tongue is red and quite bumpy and looks like the skin of a strawberry. So how do we diagnose scarlet fever? So it's through all of those things that I have mentioned. So your healthcare provider will ask those questions and examine the child and diagnose scarlet fever. Sometimes they might do a throat swab, but this is not always necessary. Once we diagnose a child as scarlet fever, we start antibiotics straight away, and we expect those symptoms to resolve after about a week. And in the latter part of the video, I'm going to talk about what signs and symptoms you need to look out for if things change that suggest you need to seek medical advice. The current guidelines say that when a child is started on antibiotics for scarlet fever, it's important that they stay away from school for a minimum of 24 hours. So they have to have had antibiotics for at least 24 hours before going back to school, providing that they're well enough to do so and you as a parent or as a guardian are happy for them to return to school. That's scarlet fever. Another disease that can be caused by strep A infection is invasive group A streptococcal infection. This is really rare, but it's very serious, hence why it's been talked about. Now, again, there's been an increase in the amount of children who've had a diagnosis of invasive group A streptococcal infection. It's serious because it has a high mortality rate. By that, we mean that there's a high number of children who can die from iGAS. Although I've said that, the majority of children who are diagnosed with invasive group A streptococcal infection recover absolutely well from it. Because it's so serious, it needs to be treated in hospital. What it means is the bacteria has gotten into parts of the body that are usually free from bacteria. So the bacteria has invaded, for example, the bloodstream, causing a really serious infection, or has gone into other organs as well. So how do we reduce the risk or prevent strep A infection? So there is no vaccine for it. However, because of how it is passed on through direct contact, sneezing, coughing, we need to continue encouraging and teaching our children the importance of basic hand hygiene. So that means washing our hands with soap and water. So we've talked about what is strep A, what are the signs and symptoms, what are the different diseases caused by strep A, how do we treat it, and preventative strategies. Now, it's really important to note that although we've talked about a lot of that in the video, most children who present with a cough or a cold or a high temperature, the majority of the time it is a viral illness. The commonest cause of a sore throat is not a bacterial infection. It is actually viral infections such as colds, flus, loads of viruses cause sore throat. So if your child has been reviewed by a healthcare professional and they felt that this is not a bacterial infection, then they will not give antibiotics. But be rest assured that we are on high alert. We know that there's an increase in the amount of children who are getting bacterial infections, and so we will give antibiotics when required. If you're one of those who's been sent home without any antibiotics or with antibiotics, we'll also tell you about signs and symptoms to look out for when you're at home that suggest that you need to give us a call back. Okay, so what are the signs and symptoms that you should be looking out for that mean I need to call my GP or call 111? So first of all, if you as a guardian are worried, we really value your knowledge of your child. Children tend to get a lot of colds and flus. So if you're worried that this is not typical for your child, you are worried that this might be something else, you've given Calpol but the temperature is not calming down, we take your concern seriously, so do seek medical advice. We worry if a child is not eating or drinking because we worry about the risk of dehydration. So do give us a call. For example, signs of dehydration are if your child's eyes are quite sunken, or if they're not going to the toilet to pee as often, or if their nappies are dry, so they're going 8 hours with a dry nappy, that's a sign to give us a call straight away. Another example is if your child is less than 3 months and they've got a temperature of 38 degrees or more. If your child is 3 months and over and they've got a temperature of 39 and above, again, give us a call. Your child is very hot and sweaty, or your child has diarrhea and they're vomiting and there's nothing to explain why they're having diarrhea and vomiting, or they're just very irritable and tired and look unwell, then give us a call. So this is when to call 999. I like to group this into 3 with some examples. So 1, difficulties in breathing. This can look like your child is really gasping for air. If they speak, they're really struggling to speak in full sentences, or they're making grunting noises, or when they're breathing, they're really using all their upper chest. So you can see like right here, that's going down when they're breathing. So you can literally see the movements here going in and out. And similarly under their ribs or in between their ribs, you can literally see that they're working hard to breathe. Or the skin, the lips, or the tongue are blue. So that's a 999 call. So that's breathing. Another one is if your child is very floppy. So they look really drowsy. They can't hold their position. So their arms, their legs, they just seem very floppy, very drowsy. They're really difficult to wake up. Or if they do wake up, they go back to sleep really easily. Or you're really struggling to wake them up. The other reason is a rash that does not disappear when you put a glass on it. So a child develops a rash and you get a glass, you press onto the skin, again, just gently, it doesn't hurt, and you look through it, and if it doesn't disappear, that's time to call 999. That might suggest meningitis. So a rash that does not disappear. So the rash that we were talking about in scarlet fever at the beginning of the video will disappear when you put a glass against it. Thank you so much for watching. I hope this video has been informative. Please do share it, like and subscribe to the channel for more videos like this. I will put some links underneath this video for more information.